Good morning, Congressman Peters. My name is Nikki, and I'm a bedside nurse who is part of a group of healthcare workers and small business owners based in California. First of all, I wanted to say thank you for taking the time to meet with me. I know you're very busy, and I really appreciate the time you have given me today.
Of course. It is a pleasure to meet you, and I'm happy to listen to your concerns and help in any way I can.
The issues I wanted to discuss with you go beyond a local and state level. They impact us on a national scale. These issues are concerning our current healthcare system, and more particularly the Affordable Care Act. Although the ACA has made progress in decreasing the uninsured rate by 8.8% in the last 10 years, there are still 47 million Americans that remain uninsured. A large majority of these Americans are those that make above the minimum requirements to qualify for Medicaid, but not enough to afford individual health insurance provided by the insurance marketplace. Health insurance companies have changed and continue to change since the implementation of the ACA due to increasing governmental regulations, which in turn have had a domino effect on insurance pricing, affordability, and quality. The health insurance marketplace plays an integral role in the development of cost containment strategies, makes expensive pharmaceuticals affordable and accessible to patients, and is sensitive to consumer preferences and demands. The ACA rules and regulations have contributed to large increases in average premiums and have driven down choices in the individual and small group markets. This has further become a major problem in small rural communities with only one hospital or medical facility. These small hospitals are running out of business because they are having to be about 90% funded by Medicare and Medicaid, reducing their provider services and ultimately reducing quality of care. Insurance companies have been forced to cancel many of their plans due to governmental defined benefits and government mandated regulations. These regulations have also affected employer-based health care coverage, causing employers to significantly narrow down the choices of coverage they provide for their employees, place restrictions on healthcare savings accounts, and increase premiums and deductibles. As a bedside nurse, a hospital employee, and a citizen of the United States, I feel it is my duty to spread awareness of the growing healthcare gap and what myself and my colleagues believe to be a slow but steady transition into socialized medicine.
Well, you definitely bring up a very debated and controversial topic. I will agree with you that this is beyond the state level. You are right in saying it affects us on a national scale. Thank you for bringing this to my attention, but what can I do to make sure you and your colleagues feel heard regarding this issue?
Thank you very much for saying that. I would like to say that I feel appreciated and heard just by speaking to you today. I have seen and read about your support for fixing current issues with the ACA while preserving the parts of our healthcare system that work. You do propose some plans for fixing certain aspects of the ACA, and I have brought with me today a brochure which I think highlights other potential solutions to the problems I mentioned earlier. As an organization of healthcare workers, we want to spread awareness of how these national changes affect us on a local and even individual level. We hope with the support of our local and state representatives to be part of a bigger community of people who feel the same so that we can affect change.
Well, thank you for bringing this to my attention. Yes, I do think there are parts of our healthcare system that function well, and we should work on fixing those that do not, instead of proposing any reckless solutions. Thank you for bringing this to my attention today. I will definitely take this one-page brochure and look over it. Please know that you and your colleagues are supported in how you feel, and I will do my best to help spread the word about this. Please feel free to reach out to me with any other suggestions or concerns you may want to express.
I will. Thank you so much for your time today, and I look forward to speaking with you again.